research suggests that women remain the most vulnerable and are experiencing higher rates of unemployment and hunger during the COVID-19 pandemic. According to the studies in Poverty and Inequality Institute, more women have been unemployed or underemployed compared to men since the beginning of the pandemic. To unpack this study, we are joined this morning by Isobel Frye. Thank you very much for your time, ma'am. Now, first of all, we've always heard, from many organizations how women are, on the back burner of employment, of economic freedom, especially in South Africa and in the economy. Explain to us exactly what your research has found that is more shocking to what we've already known even before the pandemic.
Absolutely. Thank you very much, Maseko. So our analysis is really an interpretation of the recent findings released 2 days ago by the NIDS-CRAM Joint University Research Panel that has been undertaking wave research around COVID to see the impact on poverty, unemployment and inequality specifically. Now, the findings that they released 2 days ago emphasize exactly that. The pre-COVID crisis, as we call it, is one where in South Africa we have incredibly high levels of unemployment generally. But what we see in terms of employment for women is that women tend to be far more underemployed in terms of time management, and the rate of remuneration for the same job is much lower. Women also have disjointed work careers because they have to take on the care burden. So we find that for women, we refer to it as the triple burden of having to care for the workplace as well as care for themselves and care for the home. So we have women who are not optimal in terms of the kinds of wage labor and the demands that are there. What we see, however, is that the jobs that have returned have been higher skilled, and so women traditionally go into lower skilled. Many women drop out of school in order to have children. The devastation that we've seen in these statistics talk to a phenomenon known as shielding of hunger. So women tend to feed their children first, and then older people and men. And women themselves starve. They give food away that they themselves need just for their survival in order to feed their children. So the misery of hunger is absolute, and there is no relief whatsoever. We found, Maseko, during last year's lockdown that the caregivers grant was extended, and that was a brilliant move by the state. That was to say 7.1 million women look after children on a daily basis. And let's collectivize those children. Those children are our children. They're our future. Women do this. They're unpaid. They're very poor. In order to pass the means test for their children to get the care support grant, they are the poorest of the poor. And what the state did was to give direct transfers of 500 rand to the caregivers to say, we know that you're not making ends meet. This is a crisis. You can't go out and look for work, for peace jobs. So we're giving this to you. And that, of course, there were a lot of people saying 500 is not enough. It should be per child that the woman's looking after. But it saw the problem and it fed it. What happened, however, is that in October, the caregivers grant was withdrawn, and nothing has been replaced since then. And even worse than that, Maseko, is that in terms of the policy alignment for the social relief of distress 350, because women were receiving the child support grants of 460 after that for the children, they themselves were ineligible for the social relief of distress grant. So they were discriminated against in terms of their gender because of the care work that they're doing on an unpaid basis. The social impact on that, on women who are generally in South Africa, the people who drive the households, who maintain them, it's been ferocious. And what we've seen in the NIDS-CRAM data is they've done specific studies looking at mental health, and that's depression, that's anxiety. Those are ones that are drivers now, again, in terms of diabetes and other kinds of diseases. We really need the state to listen and to do something, because we talk about gender-based violence, but as Frye, we say that this is one of the greatest violations, is when women have to starve themselves to feed those that they love.
All right. There's also the problem I see in the report of an increase in dropouts. Could this also, obviously we know that not having enough money will increase dropouts, but also could this be attributed also to children having to drop out because they need to help their parents by finding piece jobs to assist with their younger siblings, or maybe because of the statistics around single parenting in South Africa falling more on the side of women?
One of the things we focus on at Studies in Poverty and Inequality Institute are the micro-linkages. So on a macro level, the state has done a very good job again in terms of granting fee-free schools for 60% of the poorest state schools. And that was really good. However, the hidden costs are the ones that prevent kids from attending school. So scholar transport frequently in rural provinces is not what it should be. Tenders don't go through. So kids can't get to school because they don't have money for school fees. School uniforms, you're meant to be able to get some access and support from the Department of Social Development, but many kids don't do that. So whether it's social shaming that they don't have the uniform, some schools say you can't come to school. And then again, it's the question of hunger. Because if kids go to school and they've walked a number of kilometers in the morning, they haven't had anything to eat, they're unable to concentrate. They're also not developing the cognitive capacity that's required to keep pace with the schooling. And so on the one hand, an attraction has been the school feeding schemes that we had to go to court in order to get a judgment against the state to implement it last year. But the state has been really good, and the report shows that in rolling that out since the judgment. However, now with the school closures, that one meal is not happening. So you've painted the desperate situation. Hungry children, walking far, no adequate sort of uniform, the shaming of that, and we are retarding the next generation of children because they are not able to develop the kind. We talk about the fourth industrial revolution that takes a certain skill set. Our kids can't even read for cognitive capacity in grade 4. Now, we often blame that on teachers. We say teachers are not motivated. But the research shows that their brains are not developed to be able to do that. And that, for us, is a structural tragedy because we're not looking at that. So we are perpetuating the kinds of marginalization. We talk about education as being a ladder, that you should be able to mobilize, to advance yourself if you work hard enough. But these obstacles are just stacked so against children. So, I mean, the solution that we Aspire have been arguing for, both at NEDLAC and with civil society structures, is the ultimate rollout of the basic income grant. But right now we're saying we need to have the social relief of distress grant back. We need to have the caregivers grant back. And for 12 months, so you don't have poor people thinking, I've got it for 3, what's going to happen after that? I mean, as I said, the levels of depression and mental health it's as a greater humanitarian crisis for us as a caring nation, as the hunger and starvation that we're witnessing growing daily should be.